Hi, Denise. How are you?
I have more problems with the audio.
It's okay. I was like, oh, well, just because.
I don't know why it like defaults to like the volume all the way down.
Oh, really?
Yeah.
Huh. So you're talking away and still no one can hear you, right?
Yes,
Yeah, well, that's okay.
Yeah.
That's all right. How is everything?
I'm good.
Yeah, me too. Just going through the motions as usual.
Yeah.
You know what I thought about the other day? I was, I don't know who I was talking to. Oh, my manager in GME. I said, August used to be like sort of a freebie month.
I agree with you.
It's no longer a freebie month.
Yep.
I would get caught up with filing and purging old stuff. And
Yep.
no.
I actually did last week. Oddly enough, I don't know what it was. If like the planets aligned or something.
Yeah, something, huh?
Yeah. And I did exactly what you just said.
It's just like, oh my goodness. So whenever I had like a few free minutes of somebody not hounding me for something, or a deadline that, hey, you guys wake up. Yeah, I had to go through some. I still not finished, but because I do the clerkship too here for the medical students, so I have all their stuff, and I'm like, and then I have 3 non-accredited fellowships, and I do the interviews and get all that stuff, and I'm like,
yeah, that's what makes this never ending.
It's never ending.
Yeah. Yep.
Yeah. So, oh well. There's no time for much of anything else, but I have been taking the time to get out of my chair and go for a walk.
Good. I try to. Yes.
Yes. Oh my God. What a difference.
Yeah.
It is. It's just a simple walk. I don't go very far. It's just enough to get my heart rate going and, my legs. Cause I mean, I get up and it's like, I feel like I'm 95 years old.
Yeah, me too. Me too. And
I'm
I find
not quite there yet.
Like my neck, if I'm sitting here, my neck and shoulders. Yes. Yep.
Okay. So we all have that same thing. Oh, it's terrible. So I had a nice little chat with my doctor when I went for my physical, and she said, so I'm like, yes, I have to get motivated. I know. So yeah, I said the job can be very stressful, and you can find yourself sitting here for 8 hours and running to the bathroom so you don't wet your pants.
Right. Yep.
So I said, yeah, I gotta move. So that's my moving.
I have a fridge in my office that my mom had given me when she moved. And so I keep like bottles of water in there just in case there's a day where, you get slammed or somebody comes in your office. In my case, my program director is here for hours and I haven't had a chance to get water. Then at least I know there's a bottle of water in there.
You have to. That's important too. And us working in urology,
right.
We should know better, right?
Exactly. I always think that. Like, come on, you guys. When you're dehydrated.
Yeah. Yeah. So I keep my daughter bought me a Yeti cup. Nice. It's a 30-ouncer.
Yep. I have one of those at home. I love it.
Yeah. So this is what stays with me all day, and it's like I finish it. It's here in front of my face. And that's why I said I'm getting up more, because I'm holding myself and then I'm flying to the bathroom. And I said, okay, you know what? I get the job done. I don't miss deadlines. You could do this for yourself. It's not that hard. And we always forget about ourselves.
Yeah, exactly. Are you in the office every day?
Yeah.
Yeah.
They tell us that we're the safest building to be back for COVID. So like, okay. Got it. So, but I can work from home 1 or 2 days a week if I want to or need to. So it's not so bad.
That's good.
Yeah. But my daughter works from home, so I'd rather be here anyway.
I'm exactly same here. My daughter works from home most days, and the other days she rides with me.
Yeah.
There's a
So,
lot of togetherness.
yeah. So I like, because I mean, really, nobody really bothers me. And I have 2 doors that I can close myself in if I had to. But other than that, I'm back in a corner in a little, well, it's bigger than a cubicle, I guess. And yeah, I just do my stuff.
Yeah.
Well, this is very nice of you to do, because this CLER stuff never really,
This is
there's
going to
too
be
much.
overwhelming. It overwhelmed me, and I don't think it's anything like, obviously we need to, anybody needs to memorize, but it's just
Yeah.
good to remind ourselves,
Yeah.
like, this is what our
Exactly.
institutions are up against.
Yeah, it's a lot. Do you guys have a CLER officer on staff?
No, our GME office kind of manages it.
Oh, okay, yeah, there's that's what I meant. I'm sorry. Yeah, in GME, we have a actual faculty member that is the CLER officer, and it's just like, she's awesome, but it's just like, oh my God.
Yeah.
What else? I don't understand any of this. So
Our
yeah.
DIO here actually was, so I was in anesthesia for a long time before
Mhm.
coming to urology. And our DIO here was my chair there.
Oh, okay.
So, I know her very well,
Yeah.
and she's awesome, and, kind of has the CLER stuff, I think, under control.
Good. That's good.
But we're struggling with our GME office a little bit right now. We just feel like they are trying to distance themselves from us as coordinators. And now I'm the chair of like our coordinator council
Oh.
here. And
Oh.
so like today, the emails have just been pouring in, like, why do they want to spend less time meeting with us? And there's always an excuse why they don't want to meet with us.
Yeah.
And it's hard because
Yeah. No, I get it.
their questions answered.
We have a professional development meeting once a month. Sometimes it gets canceled. We do have that, but pretty much that's it. I mean, I was administrative assistant when I came here. My background was in legal. So I like kind of moved myself up, and I worked in pathology, and one of the faculty member, I was her assistant, and she said, hey, the program coordinator position opened up. And I said, yeah, what do you want me to do with that? And she was like, I want you to take it. And I'm like, I have no idea what that is. I mean, I know the residents, I know the fellows, and so I said, okay, so interview, blah, blah, blah. And I was also at the same time program coordinator for urology.
Oh, okay.
Talk about slamming somebody into a position that has no clue, and then you give her 8 programs.
Right. Yeah.
And 6 of them are accredited.
So you're not still the pathologist?
No. I couldn't do it. I was there in pathology for 3 days, and I came to urology for 2 days. Urology I wasn't doing anything for them except making their deadlines. That was it.
Yeah.
They had no policies. They had nothing.
Wow.
Yeah, it was pretty rough. It was rough. And then when they decided to split them, they gave me the choice of where I wanted to go. And I said, urology, they're sinking. They had nothing. They had absolutely nothing. So yeah, but I love what I do. I really do, but I've had to restructure myself to be able to continue to do this. Otherwise, yeah. So, but yeah. How long have you been in the field?
In the field
of medical
30 years.
education? Oh, God bless you.
Yeah.
Wow.
It was super hard leaving anesthesia because it was like my family.
Right.
It was so hard, but urology has been awesome.
Yeah.
And I have been so fortunate. I've had, awesome program directors look out for me, and awesome residents.
That's good.
you're right.
Yeah.
I love this job. And, you know, it's not like there was a day when it was like, I'm going to be a CLER coordinator when I grow up, you know?
When I grow up.
Yeah, same thing. I
Yeah,
was
right,
an
no.
admin assistant and anesthesia.
Yep.
And it's like, hey, this job is available. You interested?
Yeah, exactly. That's how it was presented to me. And I'm like, oh my God, when I cried probably my first 3 years, because I was like, what did I get into? Because
Yep.
for 3 years I had both
Yep.
programs.
Yep.
I was like, this is, I mean, I was working my tail end off.
Yeah.
Just trying to stay above water with both of them. Cause and then they would attack each other because interview season would come and it was all at the same time, right?
Yeah.
Well, we need her here. No, well, we need her here. Well, y'all figure that out.
That is so much running around. I mean,
Oh,
gosh, those days were just,
yeah,
it could be torturous.
it was. I don't miss it.
Yeah, I don't miss it either,
In
to be honest
person?
with
No,
you.
no.
I love meeting new people,
Yeah,
but
me too, but they don't realize what you go through. Oh,
go home exhausted, your feet hurt,
yeah,
you know, you spent all day anxious about what's going to go right or wrong. And
yeah, exactly. Yeah. All right, I'll let you get to your stuff. I'm sure you have stuff you need to go on, and we only have like a minute. I won't bother you no more.
oh, you're not bothering me at all.
Thank you.
It's actually very helpful because I always get really nervous. So it's nice
Hi.
to not think
No,
about
you're a
it.
wonderful presenter. Are you kidding?
Oh,
No, I mean though. I mean, I look like grandma.
you did not.
I mean, I am a grandma, but I mean, I even look the part. Ugh. Like, wow, my hair's clean, my clothes are clean, I'm clean. Just take it as or leave it. I'm not here for, you know, the beauty contest.
Exactly. Exactly. Yeah, I have my like tennis shoes on as I'm sitting here. You know what I mean? It's like now we can just I
Yeah,
could
I
do
mean,
pajama pants, but I'm in the office, so I'm not in pajamas.
exactly, right. And we don't have in-person meetings anymore where we had to make sure we were, you know, in the right outfit.
Exactly.
So the top up looks gorgeous, bottom down, don't look.
Well, thanks for joining, everyone. I'm going to wait maybe just another minute before I start sharing my slides. At some point in the talk, there are actual, like I will ask questions. So you guys are welcome to either unmute and answer them or put them in the chat. I mean, it's not, you know, it's not a test. We're not testing anybody. It's just to kind of give you an idea of what you could expect if you were taking the time. So we'll talk a little bit about that. So I just started this. All right. So sorry, I have 3 monitors in here, and I don't know why all of a sudden this is just being very strange. So if you see my head kind of looking off in an opposite direction, it's because I'm looking at a different monitor. But hopefully it looks okay to everybody. Is this the right setting? How does that look? Okay. All right, so I am Denise Massell, and I am the coordinator at the University of Wisconsin here in Madison, Wisconsin. And welcome to what we have now renamed our supplemental learning opportunity. which we referred to as our TAGME study session in the past, and we'll get to a little bit as to why we changed the name. But today we're just going to talk about CLER Pathways to Excellence and the ACGME institutional requirements. So here's our outline, and we'll just go through, like I said, quickly why we changed the name of this. A few TAGME tips for those of you who are maybe planning on taking the TAGME exam this year or in the future. And then these are just the two areas that we'll discuss: the CLER Pathways to Excellence and the institutional requirements. And those page numbers refer to the page numbers of the information that TAGME provides to all of their exam takers. So basically it's an open book test and they provide you with the book, so to speak. All right, so the reason why we changed the name of the session, I am the chair of the ACGME Professional Development Committee and am on the ACGME Executive Committee. And so we discuss this at both of our meetings. And really to kind of try to increase the number of people who attend these sessions, because really the topics presented are pertinent to all coordinators. So it isn't necessarily, just for people who are taking the TAGME exam, but for anybody that wants to learn a little bit more about various GME related topics. So we won't necessarily always cover stuff that's in the TAGME study guide. Most of the time we probably will, because there's a lot of information in there. But we will probably discuss other topics as well. So this is going to be kind of a combination of, this is what you can expect to see related to these two different, to the CLER and to the institutional requirements, as well as some questions, just to kind of give you an idea of, what you might be tested on if you take the TAGME exam. Just some quick TAGME study tips for anybody who is planning on taking it. Like I said, it's an open book test. TAGME provides you the study guide, and that is everything that you would study, and that is what you would use during your exam. Lynn Bass, who was actually the coordinator who started all of these wonderful TAGME study sessions, recommended studying 4 to 6 weeks prior to the test. I've taken the test 3 times. The last time I took the test, I did study for probably a month and a half, and really only did it kind of on my lunch hours. So a little bit of studying in each section for a half an hour or so a day during the week. And then I studied for a few hours the night before. But really, you're not going to have to memorize anything, because it's all going to be available to you. So really the key is knowing where to find the information. And when I took the exam, it did even jump around. So it actually would test you on a certain, if it was the common program requirements, there would be say 6 questions related to the common program requirements, and then it would move on to another section. So you didn't have to flip back and forth through that whole huge binder. It would at least allow you to look at one section for each of them. I put all of those study materials into a binder with tabs, so I could easily just sort or skip through it as I was looking for answers. It is available to you as a PDF, which you can open during the exam. So you have either option. You can go old school with the paper, or you can use the online PDF. For testing skills, the glossary of terms and the FAQs are good for drills. You will not be tested on urology requirements specifically. You will be tested on the common program requirements, institutional program requirements, and then anything else that's provided in that study guide. And then lastly, we would just tell everybody to try to attend as many of these study groups as you can, just because it's good reinforcement. All right, so what is CLER and how will it affect you? So obviously up here you'll see it's clinical learning environment review. We'll move on to this. So the ACGME established the CLER program in 2012. to provide GME leaders and executive leaders of hospitals, medical centers, other clinical settings with formative feedback aimed at improving patient care while optimizing the clinical learning environment in 6 important areas. The CLER program conducts site visits to hospitals, medical centers, and other clinical settings of ACGME accredited institutions that host residency and fellowship programs. So you have probably all had these at your institution. If you haven't, and you have any questions, we can definitely talk about it at the end. We've probably had 3 or 4 since this started in 2012. So here we have a question. During these visits, the CLER field representative will meet with, what do you guys think is the correct answer?
F.
Correct. So they'll meet with a group of residents and fellows, the DIO, and other members of the C-suite, which I will admit I didn't even know what that meant the first time I heard it, but you know, like your CEO, your CFO, all of your Cs, and then a variety of program directors. So how will you be involved? And I would say that this probably depends on your institution. Here we are often asked to provide the sponsoring institution with information, helping to provide peer-selected residents to meet with the reviewers or to do walking rounds with the field representatives. So your residents may end up having to do these walking rounds with the field guides or the field representatives. You know, you may need to make sure that your PD, your APD, or other faculty attend these group meetings. I remember a group meeting where it was really specific. They all had to leave their pagers and their phones outside of the room, and they had to be there on time or else. And I don't know what the or else meant, but they were told pretty clearly they had to be there on time. So we got a ton of messages from our institution and our GME office regarding this and how we should be available here. Oftentimes when we have like a CLER review or when JACO comes to visit, we are often asked that we make sure that there's somebody in the office that knows where to find resident files. I don't think CLER asks for that, but JACO sometimes will. But that being said, coordinators do not meet with the reviewers. So that's not something that you will have to worry about if you've not been involved in a CLER visit before. So these are just the CLER pathways to excellence. These are what they come when they come to your learning environment to, you know, look around. This is what they're looking at: patient safety, healthcare quality, teaming supervision, well-being, and professionalism. So I'm just going to say, before we move on to the next slide, that there is a lot of information contained in it. I'm not going to read it. You don't necessarily have to read through it. It's something you can go back and look at if you're super interested in it. But it's just to give you an idea of what you will have to look through if you take the TAGME exam. That they may ask you a question, and this may be what you'll be looking through to find the answer to the question. All right, so first off, patient safety. These are the 7 pathways that they come and look, you know, review when they come for the CLER visit. You can just take a look at all of these things. And it's just, you know, it was interesting to me as I was putting this together to just go through it and remind myself what it is that our clinical learning environments are required to provide, required to ensure, required to conduct. And then just, it also made me think, do we do all of these things? And I think, you know, yeah, we do. And if we don't, that's obviously a big problem. But it's just good to remind us who are down kind of in the weeds a little bit sometimes, what the bigger institution is having to deal with. So I know for like our residents, where it says things like giving them experiences related to patient safety, we actually, for our incoming new residents, have a required patient safety orientation where they do like an RCA and they talk about patient safety event like it says here, RRCAs and reporting safety events and stuff like that. So that's one way that our institution helps our programs meet those requirements. Then the next section is the healthcare quality. Again, you would, maybe ask questions on any of these things. Teaming, which is a word I guess we don't use much here, maybe others do, so this was a little bit new to me. But again, really seems to be about interprofessional learning and development, one of the core competencies. Supervision, which is obviously a big thing really for us at the program level. We all obviously have to have policies related to supervision of our trainees. And so it's just a good thing to take a look at. Well-being, you can see there's a lot of them, 6 pathways related to well-being. Again, something hopefully everybody is doing at the program level as well as at the institutional level, making sure that our learners and our physicians and really all of our staff are being able to work in a community that takes well-being seriously. And then professionalism is the last of sort of those core competencies that the field reviewer will come and look at and talk to your residents and faculty and the C-suite about. All right, so next slide. Your sponsoring institution must provide all members of the clinical care team with quality improvement outcomes. True or false? All right, so the answer to that is true. And then the next question here, a nursing assistant witnesses a PGY1 performing a bedside procedure unsupervised. Should he assume the resident can perform the procedure unsupervised or consult the institution's database for verifying required level of supervision? And I am sorry if people are putting this in the chat for whatever reason, I am unable to see the chat right now. So the answer is to consult the institution's database for verifying required level of supervision. And does your institution have a mechanism in place for staff to search required levels of supervision? Do you know where it is? Do your residents and faculty know, which I think is the bigger key? We have a database that like our nursing staff and really any of our staff can access. And we also track this and keep a list of what residents are able to do with the various forms of supervision. So indirect supervision, oversight, whatever it might be at each level. And we keep that in MedHub here at our institution. So that's just something to, if you're not sure where that is, something to take a look for. All right. So we will move on to the ACGME institutional requirements. As I said before, that was a lot of information about CLER, and at the end here, we can talk about it if people have questions or want to make comments. But we'll move on to the institutional requirements. Again, there are various areas here that the requirements are kind of broken down into. And we'll just go through this. Learning and work environments. The same thing we just kind of went through with the CLER visit. All right. Designated institution official. So you'll all have a DIO. Authority and responsibility for oversight and admin of the sponsoring institution's ACGME accredited programs is part of the DIO's job description. He or she approves PLAs, oversees ADS submissions of applications and requests for complement changes. He or she must document your sponsoring institution's GME mission, complete a self-study prior to the tenure site visit, and be a voting member of GMAC. Our DIO is the chair of our GMAC. So requirements differ for sponsoring institutions with one accredited program versus sponsoring institutions with multiple accredited programs. Again, I'm only telling you that because that could be a question that you may see on a TAGME exam. GMAC must have at least the following voting members, and you probably know this if you attend your GMAC meetings: the DIO, a representative sample of PDs, peer selected residents or fellows, and a QI or patient safety officer. They must meet once every quarter at a minimum. Every meeting must have one trainee in attendance, and they must maintain minutes. So we'll do a question again. The responsibilities of GMAC oversight must include, which of these? All right, so all of the above. And while training well-being does not appear in the requirements, and therefore would not be your answer on the TAGME exam, because you have to answer the question based on what you see in front of you in that guide, I like to believe that GMAC does and should have oversight over training well-being. And I'm guessing most GMACs do take that into account. So that being said, B, C, D, and E would technically be the correct answer if we were taking the test. All right, the GMAC must meet a minimum of blank during an academic year. And quarterly, and there at the bottom where you see the IB3 is where in the program requirements you would find the answer to that. All right. Your program wants to delete a participating site. Do you need GMAC's approval? True or false? Oh, there, the chat's coming up. All right, I'll get with it here.
I think it's false.
Get on my right screen here. Actually true. So if you want to delete a participating site, you do need GMAC's approval. We did this recently, and I think it was just for us, it was just a matter of like writing a letter and including it in the GMAC packet that everybody votes on. So, all right. So we'll just take a little bit of a break here. This is just a picture I found. Probably northern Wisconsin in the fall, but the trees are starting to turn a little bit here. So just curious if you guys regularly attend GMAC meetings as coordinators, if you're members of the GMAC, if you've ever been involved in a special review process, and as Susan and I were talking a little bit before you guys jumped on, if your GME office is a source of help to you.
Well, I'm not part of the GMEC at all.
No.
No. Or a special review process. No.
No. We all of our coordinators here are invited. Oh, good. So somebody has been involved in a special review.
Oh, good.
And some of us are members. It just really depends on, you know, if the DIO invites us to be members. I've been a voting member on GMAC and probably will be again this year. I've been involved in a lot of special reviews, and I think they're super, super helpful. They can be a great deal of work, especially if my PD is a we have review teams. So if he's the senior reviewer, a lot of times I end up like doing a lot of helping him quite a lot with the work and writing the reports and stuff. But I think they're super helpful to see how other programs manage their requirements, manage their program. So I always tell the coordinators here, if you can get involved in that, I know it sounds really daunting, but once you feel comfortable in your job, I think it's a great way to see what other people are doing. And hopefully everybody has a GME office that is a source of help. Ours, for the most part, is, we were just talking a little bit about them pulling back just a bit, and the coordinators feeling a little bit frustrated by that. So, all right. So, also included in the institutional requirements is a little bit about the annual institutional review. The GMAC must identify institutional performance indicators for the AIR to include at a minimum all of these things you see here. So really you have to discuss the ACGME institutional letter of notification, the results from the surveys, so the resident and fellow surveys and the faculty member surveys, each of the program's accreditation information, and the rest of the things that you see here. We have one GMAC every year. Ours is in August, that is dedicated to the annual institutional review. And all voting members of GMAC receive like a SWOT analysis a week or so prior and get to like basically, you know, tell the DIO what we think is our institutional strengths, weaknesses, opportunities, and threats. And then they just put together all of this information that you see on this slide for GMAC to review, essentially. So you review everybody's survey results and everybody's accreditation and all of that. And then the DIO writes this designated institutional official executive summary. And then our institution actually puts together like an AIR report that they send out as well. So institutional resources is another section in the institutional requirements that include all of these things here. You see the GME infrastructure, program administration, etc. So the question, the sponsoring institution is required to ensure availability of adequate resources for resident fellow education with the exception of So the answer is 3. However, they must include resources, including space, technology, and supplies to provide effective support for each of its ACGME accredited programs. So really the thing that kind of gives that away there is the large screen TV. I mean, we're not required to provide them large screen TVs. We are required to provide everything else that we see on the slide here. So we all know about the support for our faculty, for our program coordinators, for our PDs, and sleep rooms for our residents. We just don't have to go so far as to provide them with a media room. All right, so this was kind of news to me, even though I know that we have one because this was discussed recently at a GMAC meeting for us, but institutions are required to have a resident forum or opportunity, or where trainees have the opportunity to directly raise a concern, to conduct at least part of it without the DIO or any faculty members present, and have the option to present concerns that arise from discussions of at the forum to the DIO and GMAC. So I don't, quite honestly, this may be a new requirement. I don't remember this being a part of our GMAC until, like I said, probably 5 or 6 months ago, where our GME office and our DIO did hold a resident fellow forum, and they asked one of the residents to come and report out at GMAC. And their 2 biggest concerns, and the program directors flipped their lids when they heard, when this resident said this, was basically their frustration with their inability to get clean call rooms when they needed them. And their frustration with the fact that if they needed a COVID test, they had to drive like 25 minutes across town to get it when there is like an employee health here on site. So both of those things were dissatisfiers for the residents, and the program directors were really, I think, kind of taken aback. I think a lot of us didn't really know that, and I know that the leadership didn't know that. So I think some changes have been made due to that. So this is great. This is a great opportunity for residents and fellows, and hopefully institutions are, because they have to, obviously, taking advantage of this opportunity. So which of the following tools or services must sponsoring institutions ensure exists? All right, and the answer is all of the above, which I'm sure we all have all of these things: IT, patient transport services, access to medical literature, and medical records. The learning and working environment. The sponsoring institution is responsible for oversight and documentation of resident fellow engagement in the following. So all of these things we kind of discussed when we were talking about the CLER site visit. The sponsoring institution has to make sure that they have oversight and they document that we're doing all of these things. So the sponsoring institution, in partnership with its ACGME accredited programs, must provide access to appropriate tools for self-screening in relation to wellness. True or false? Yep, I see some answers in the chat, and that is true. All right. Which of the following is the sponsoring institution not required to provide? Yeah, good job, guys. For free food. However, there must be access to food during clinical and educational assignments. We probably 6 months ago were really struggling, I think, to find enough people to work in our various cafeterias and other areas where we sold food. And so they really had to close down a number of them, which was kind of a problem. So during that time, we actually in our department like supplied the residents with snacks until that was all back kind of up and running again with 24/7 access. There was always food access, but getting food out of the vending machine isn't necessarily always food access in the mind of the residents. All right, so the sponsoring institution, in partnership with each of its programs, must engage in practices that focus on ongoing mission-driven, systematic recruitment and retention of a diverse and inclusive workforce of trainees, faculty members, senior administrative staff members, and other relevant members of its GME community. And I just put this out there. I think, this is a big thing in GME now, and something we're all, I think, really focused on. So just kind of a reminder. And actually going back to this one, I think from a TAGME perspective, the thing to keep in mind is as you're reading this question that, you're looking for what is not required opposed to what is. So they can kind of throw those out there sometimes and make the questions maybe a little bit more difficult or confusing. All right. So institutional GME policies and procedures, as we all know, these are all policies and procedures that our sponsoring institutions are required to have. In a lot of cases, we are all required to have them at the program level as well. one of the things that keeps us all busy, keeping our policies and procedures up to date. All right, so which of the following
Can I just ask the question, Denise?
Sure.
What's substantial? Can you go back to the slide? What's sustainable disruptions? What's that?
That is, if like a hurricane hit, I think that's probably one of the examples that has actually happened. And, you know, your sponsoring institution is somewhat destroyed and the residents have to be sent somewhere else.
Okay, I'm following now. I just kind of weird to see like what did that mean to break it down? But now I see what you're saying. I get what you. There have been times when that has happened, so I understand.
Yeah, and I think, you know, you see closures and reductions too, where I think recently there was a healthcare facility that was bought out, I believe, and their residents, so numerous of their ACGME programs were just basically like they didn't have, I don't know if it was the money for them or whatever, and they basically had to, you know, find homes for those residents.
Oh, wow.
Yeah, yeah. One of the things that we all, I think, hope never happens to us.
Yes. Thank you.
You're welcome. All right, so which of the following is not required to be referenced in a contract or agreement of appointment? All right. I think I chose 3 again, but you're right. A map is not required, but nice for anyone who's visiting. We just recently had some visiting students and we sent them maps and they just thought that was the greatest thing ever. So I was pretty happy about that. It's really the little victories, you know. So the sponsoring institution must ensure that each of its programs provides a resident fellow with a written notice of intent when that resident's agreement will not be renewed, when that resident will not be promoted to the next level of training, or when that resident will be dismissed. True or false? Yeah, good job, guys. That is true. All right, if your trainees are required to attend orientation, must the sponsoring institution provide health insurance during that period? True or false? All right, so we have a couple different answers, and I hope I'm interpreting this correctly. If the first day of health insurance eligibility is not the first day that resident fellows are required to report, then the resident fellows must be given advanced access to information regarding interim coverage. So I think that the way I'm reading this is if your sponsoring institution's policy on health insurance eligibility is their first day, then, and you're requiring them to attend orientation, that yes, that would be their first day. But if their eligibility starts on the first day of the month, so if they start on June 24th, but their eligibility is not until July 1st, because it's like day 1 of a month, then it would be. All right. Do your residents get 6 weeks of paid medical parental leave? All right, I'm seeing yeses. And if not, they should. So that is a new requirement that residents, be it female or male, get 6 weeks of paid leave. I think that's a great new requirement. All right. Does your sponsoring institution's physician impairment policy have to be GME specific? True or false? Or yes or no? I don't want to look at it. saying true. It's actually false. You must have a policy. Your sponsoring institution must have a policy, but it doesn't necessarily have to be GME specific. I like to think that most programs have their own specific physician impairment policy, or maybe as part of their well-being policy. All right, so if there were to be, say, a global pandemic that disrupted patient care in your sponsoring institution, would your sponsoring institution be required to have policies and procedures addressing such a situation? Everybody's saying true. Yes. So it must maintain a policy consistent with ACGME policies and procedures that address support for each of its programs in the event of a disaster, like we said, the hurricane, or other substantial disruption in patient care or education. If your sponsoring institution were to close, would it be required to let trainees complete training and or assist with placement elsewhere? Yes, true. And then lastly, questions or comments? When was the last time you read your institutional requirements? I am going to, if you guys are okay with it, I'm going to stop sharing so that I can at least see everybody. And then if we want to chat about anything, we can. All right, so that was a ton of information, which I thought would take us to 12 o'clock, my time anyway, but it didn't. So if anybody wants to talk about anything, you can certainly pull up the slides again, but if you have any specific questions or comments, I'm just happy to hear. If anybody is planning on getting TAGME certified anytime soon this year?
Not this year, but I'm like, I want to study for it. But I know you said it's a month and a half of studies, but I still feel like I need to get it together first.
That's awesome. Yeah. But again, really the most important take home is, being able to find the information, being able to interpret the question, opposed to, trying to retain as much information. Because I would be so doomed if I had to retain that information. Just like those days are over for me.
I know you aren't too happy.
Otherwise, how's everyone doing? Is everybody getting ready for recruitment season? Getting ready for ERAS to open?
Looking forward to it, but not looking forward to it.
Mm-hmm.
Looking forward to it.
Yeah.
Super excited. Are you guys doing in person or well?
No, it's virtual.
No, virtual.
Yeah.
So quick question, do you guys do like a mix, a meet and greet with them the day before the interviews?
Mm-hmm. We do.
And do you provide anything for it?
No.
No? Okay.
We have no money.
I like part of a suggestion that we had last year from, I did a survey after the meeting. It's like they wanted to do a meet and greet. And then someone kind of mentioned like, well, I attended a meet and greet in such and such place. And they provided us with a gift card. So
yeah,
I spoke to my PD about it. And then so we're thinking about it. It might just be, we don't have a lot of people. We might just be interviewing about 70 people because we only have 2 slots. And so we're thinking about getting them the card. So I thought it was a general thing.
Are you doing a meet and greet in person or virtual?
Virtual.
So
we're gonna
I've done that in the past, so we gave them like a Grubhub certificate to order something.
to order something. Okay, like what's the price range?
I think the most we did was $15. It's one person, so you can get, yeah.
Okay, that's good. Thank you.
It's interesting because, like, it's not like because we don't have the money to do it, but we have all these rules here about what we can provide and what we can't. And maybe that's just their way of telling us, no, we don't have the money, we don't want to give you the money, but that's what we've run up against here anyway. Is, we're not allowed to send people like gifts.
Last year I sent them gifts. I got them those little speakers, the desk speakers with our logo on it. That was well received. But this year, if I send them the $15 meet and greet card from Grubhub, I will not send a gift because that like pretty much around the same price. It's gonna be one or the other.
We do, however, get our residents pizza when they have to do the meet and greet, so that they'll at least show up.
Yeah, that will get them to. Oh no, mine's are fancy. They want like restaurant food. They don't want pizza. Like if they have to be here, they're gonna make me pay for it.
What city are you in?
New York. I'm at
Okay.
Lenox Hill. Yeah.
I mean, our residents would love us to provide them a great dinner too. They did. They know that. They get. Well, thank you guys for joining. I'm so happy to take anybody's recommendations for things you would like us to present in the future, whether it's one of these supplemental learning opportunities or to try to find a speaker for some other professional development session we could have. I mean, anytime you have an idea, or if you run across a speaker you've seen somewhere, please feel free to send it my way. We just want to provide people with the information they need to be able to do their jobs better, also without wasting people's time. So, and I will put a plug in, for anybody who is taking the test, doing one of these sessions is a great way to kind of force yourself to have to read over the test booklet that TAGME provides. So if anybody is ever interested in doing that, let me know as well. Next month, we have a visitor speaking with us for a professional development session. I don't know what the topic is. I'm going to reach out again to her probably tomorrow to see. So, but I'll send something out to our home office course and hopefully see everybody there.
Thank you.
You're very welcome. Everybody have a great day and a great upcoming weekend.
You too. Thank you.
Yes. Yep. Take care.
Bye, everyone.
Bye.
Bye.